Welcome to my YouTube channel. I'm Dr. Emma Kamau. The title of this video is Validated Tools Are Objective and Guide Nurses in Preventative Interventions to Ensure Patient Safety. I have provided 3 examples of scales that are used in healthcare to keep patients safe. Number 1, Mohs scale is used to measure the risk of a patient's fall in the hospital. Brader scale measures the risk of developing sacral pressure ulcers in healthcare. RN readiness for hospital discharge scale measures the readiness for patient discharge. So it evaluates patients understanding the instructions of discharge. Discharge instructions include things that a patient needs to do and things that they should avoid. And of course, there is information about medication as well as following up for some laboratory work as well as testing such as X-rays, CAT scans, or MRI. On the table, I have the first column, which is the standards of quality, reliability, and validity are important principles that are used during quality improvement, as well as in developing these skills that are used in improving patient care quality. On the second column, function, the Mohs scale results are reproducible, which means if 3 different nurses use the scale to assess one patient on their risk for fall, they should all come up with a score of 46. Usually this can change. If the patient is improving, this score should decrease, and if the patient is getting worse, then the patient risk for fall also increases. Under validity, here we are trying to make sure that the tool measures what it's intended to measure. So the Mohs scale is a very good scale that helps to assess patient risk for fall. Under column 3, accuracy, the Mohs scale results are consistent across settings. This is to mean that if nurses in different specialties and nurses in outpatient or inpatient should also be able to use this scale and have accurate scores for patients. On the second part, if we have a group of observers, for example, group 1, 2, and 3, observe nurses assessing patient risk for fall, their documentation on what nurses are doing, whether they are doing it correctly or not, that information of evaluation results on what the observed nurses doing should also be the same. So if there were mistakes done, each group should be able to provide that mistake that they observed. And if there were no mistakes, they did everything correctly, then that should be indicated in the 3 different groups, indicating what they found, and should be the same across the 3 groups. Time frame. Assessing a patient risk for fall should not take no more than 5 to 10 minutes. So nurses in different areas should be able to take more or less the same time. Another important factor is staff training. All nurses who are using the Mohs scale need to be well trained and assessed to make sure that they understand how to use the Mohs scale. And column 4, we have the relationship. Reliable results are not always valid. If a staff uses the Mohs scale without proper training, the results are not valid or reliable. Under validity, valid results are reliable. Results may be reproducible but are not correct. And validity is also hard to measure. So if you have any questions or comments, please feel free to write them at below the video. Thank you for listening. Please join me on the next video.